1.
Good evening. Chair calls to order Board of Health update. Tonight, it's our pleasure to welcome again Dr. Russell Moy, Harford County Health Officer, with his COVID-19 update. Good evening, sir.
Good evening, Council President Vincenti and members of the Board of Health. I'm here to give this week's health update. I'll begin with the COVID-19 numbers. As of today, June the 2nd, worldwide, 6.3 million cases with 376,000 deaths. In the United States, 1.8 million cases with 105,000 deaths. In Maryland, over 54,000 cases have tested positive, compared with over 260,000 who have tested negative, with 2,474 confirmed deaths. In Harford County, 891 cases, and that's compared with 795 cases this time last week. In Harford County, 48 confirmed deaths, and that's compared with 45 deaths this time last week. So there was an increase of 3 deaths over the past week, which is a better trend than the previous week when there was an increase of 13 deaths. Taking a closer look at Harford County's specific age data as of today, it shows that those between the ages of 18 and 64, they make up 71% of the COVID cases, but account for only 6% of deaths. And those age 65 or older make up 28% of the cases, but account for 94% of the deaths. And then for those under age 18 in Harford County, so far they account for only 1% of the cases and no deaths. Statewide, of Maryland's over 2,400 deaths, there's only been 1 death to a person under age 18. And that was to the 15-year-old from Baltimore County who had that multi-system inflammatory syndrome, that rare COVID-related disease in children. Taking a closer look at Harford County specific nursing home data shows that nursing home resident and staff COVID cases make up 26% of the county's COVID cases, but they account for 54% of the county's COVID deaths. So again, this confirms our understanding that although everyone's at risk for getting COVID, it's those who are at higher risk, the older folks and those with underlying medical conditions that are more likely to die from the virus. So now that Maryland's reopening is about 2 weeks old since Governor Hogan lifted the stay-at-home order on May 15th, we are now well into stage 1 of the reopening plan. And it's important for us to keep track of our COVID-related numbers. So from a state perspective, the metrics being tracked include, first, the number of new COVID cases. So over the last 14 days, the number of daily cases has come down from 1,091 on May the 14th to 848 cases today, and that's a 22% decrease. Looking at the number of new COVID deaths, over the past 14 days, the number of new deaths have gone from a high point of 34 deaths on May the 14th to 10 deaths reported today. For the number of hospitalizations, that's also been on a steady downward trend with 1,538 hospitalizations on May the 14th, and that's down to 1,372 hospitalizations today, and that's an 11% decrease. The ICU bed usage numbers has also been a steady downward trend with 569 ICU beds used on May the 14th, down to 481 ICU beds today. That's a 15% decrease. And then the state's positivity rate, which I kind of mentioned last week, that reflects the number of positive COVID tests compared with the number of negative COVID tests done in the state. And that's another metric being carefully followed. And the lower the positivity rate, the better. It's preferable that it's under 12%. The state is now calculating its positivity rate as a 7-day rolling average to reflect the most recent data collected. So as of today, the state's positivity rate is 10.5%. Harford County's 7-day rolling positivity rate is even better. It's at 6.6%, which is the lowest positivity rate of the 11 largest Maryland jurisdictions that have at least 800 COVID cases. And in fact, when you compare us with each of the 24 Maryland jurisdictions, we have the 8th lowest positivity rate, and that's regardless of the population size of the county or the number of reported cases in the county. So we're doing very well with that metric. And as a reminder, the reasons a low positivity rate in testing is a good sign. First, it suggests that the spread of COVID in our county is relatively low. And second, it's not because we aren't testing a lot, it's because it shows we're testing enough of our population to make informed decisions about reopening. And for that, I think a lot of the credit goes to the Harford County providers who've been ordering these tests, especially Upper Chesapeake Health, who, as you all know, is running the drive-through COVID testing site at the Forest Hill Veep. And they've conducted over 3,000 COVID tests since opening in March. So despite the good positivity rate, it's one of the areas that we could still probably improve on is the percent of our county's entire population that have been tested for COVID-19. So statewide, Maryland has tested 5.2% of its entire population, while in Harford County, we've tested 3.9% of our population. So hopefully that will increase in coming weeks. So to round out our Harford County numbers, we continue to have a low number of COVID cases per 100,000 population and a low number of COVID deaths per 100,000 population amongst the 11 largest Maryland jurisdictions that have at least 800 COVID cases. Right now, Harford County has a COVID mortality rate of about 19 deaths per 100,000 population, and that's compared to a Maryland state average of 41 deaths per 100,000 population. So in summary, those of us in public health, we're of course carefully watching all of these numbers as the state enters its third week of the reopening plan. So we should say focus on answering some basic questions to be sure we're on the right track. And so here are 4 questions we're following closely. The first one is the rate of COVID cases and deaths decreasing? And right now, the numbers are trending slowly downward in the right direction. The second question, is COVID testing widespread enough to identify new cases? And right now, the answer is that in Harford County, yes, our positivity rate is good, showing that our testing is widely enough available and that the spread of COVID in the general population is relatively low. Third question, do hospitals have capacity to treat a surge of COVID hospitalizations? And the answer to that is right now, yes. So statewide data is showing that hospitalizations and ICU bed usage is trending downward. The hospital bed utilization is only 45 to 50% capacity. And then the latest data I've seen shows that Upper Chesapeake Health's hospital bed reserve capacity is even better than the state average, more in the 30% range. Fourth question is finally, are we finding and isolating most new cases before COVID spreads? And for this last point, I want to go over what's being done at the state level as it relates to contact tracing, which has been in the news a lot lately. So contact tracing, that's the process where you identify people who may have come into contact with an individual with an infectious disease, and in this case, COVID-19. So the contact tracer reaches out by phone to someone who's tested positive for the virus to determine their whereabouts and to identify their close contacts for the 2-week period of time when they may have been infectious. So in this way, these contact tracers help to contain the spread of the infection. And they do so. They do so by checking to see who they may have exposed, and then they try to limit their opportunity for unknowingly spreading that virus to others. So prior to this COVID pandemic, there were only about 250 individuals doing contact tracing in Maryland, including 10 of our staff in our Public Health Outbreak Investigation Unit. Understanding the importance of the contact tracing, the state of Maryland contracted with a nationally recognized organization called the National Opinion Research Center. And that immediately expanded the state's capacity of contact tracing from 250 to 1,400. So this statewide project is called COVID Link. And there's a tab on the state's website at coronavirus.maryland.gov that describes this project in greater detail. So starting later this week, Marylanders who've tested positive for COVID, as well as their contacts, will be getting phone calls with a caller ID that says MD COVID. These contact tracers will follow up with these individuals who've tested positive for COVID. The contact tracers will provide education and information, but they're going to also get a detailed history of that person's contacts over the past couple of weeks. Then the contact tracers will call those individuals, and there might be many of them, who may have had close contact with the COVID positive individual, and then inform them that they may have been exposed. So you can see that the contact tracer's job is a hard one. Sometimes they are the first ones to inform a person that they have tested positive. And then they have to inform them that they may have to self-isolate for 10 days. Sometimes they are the first ones to inform a person that they may have been exposed to a person with COVID. And then they have to inform them they may have to quarantine for 14 days. So you can imagine how this news and how that discussion can be stressful. But contact tracers are trained to answer these questions and be as supportive as possible. But you can imagine how difficult it would be for a contact tracer to tell a person that they've been exposed to COVID. And then the person asks, well, then who exposed me to this virus? And the contact tracer will have to say, I'm sorry, I can't tell you the person's name because of federal HIPAA confidentiality laws. So you can imagine how hard those discussions are. And yet it's critical that those discussions take place because this is the best way to contain the spread of an extremely contagious virus. So in summary, this enhanced contact tracing project called COVID Link will begin later this week and probably will be one of the most important strategies for preventing a possible resurgence of COVID. This is the so-called second wave that folks are all concerned about. So now I'd like to turn my final remarks tonight to ones that are of a personal note. As some of you may have heard, for family reasons, I'm planning to retire from my position as the Harford County Health Officer this fall, and that's after 31 years of service in the state of Maryland system, the last 9 years with the Harford County Health Department. So I want to express my sincere thanks to all of you on the Board of Health, especially Council President Vincenti, who I've worked with very closely, as he and all of you have been such strong supporters of public health and health in general in the county. That's contributed to our consistently high county health rankings over the years. In addition, we've been totally supported by County Executive Glassman, Director of Administration Boniface, and the entire excellent county government team. Without question, one of the strongest county teams in the state. Also want to thank Mr. Lyle Sheldon and his team at Upper Chesapeake Health and the entire healthcare community, as well as community members at large who have all been outstanding partners. And of course, my deepest appreciation goes to our own Harford County Health Department staff, all of our talented, senior, and dedicated leaders, and especially our Deputy Health Officer, Marcy Austin, who many of you know is the heart and soul of our organization. Over the years, we faced a number of challenging public health issues here, including the opioid epidemic, the tobacco and vaping crises, and of course, the coronavirus pandemic. I think we've taken a calm, rational, and data-driven approach to these crises. And as of now, I think we're doing as well as any jurisdiction in Maryland. I believe that the organization is on stable ground, in fact, on a strong foundation, ready to see the county through to the future. So in order not to leave the health department with a gap in leadership, I've discussed with Council President Vincenti my willingness to work with the state and the county to recruit for my successor during my last months with you this summer, so that hopefully a new health officer can be on board as early as this fall. And of course, I'll do everything possible to assure as smooth a transition as possible over the coming months. And with that, be happy to answer any questions.
Thank you, Dr. Moy. It's been both an honor and pleasure to work with you up to this point. I can't tell you how much we appreciate having you in the position that you've been in. I've said many, many times that there's no one any more equipped than you to have the proper temperament and personality as we went through these troubling times and continue to go through them. And with that, I'd like to open up the floor to my council colleagues for any questions. Gentlemen. Councilman Jan Giordano.
Dr. Moy, as a new council member the past year, you've given a lot of information that's really helped out. I certainly appreciate it, especially in this whole coronavirus thing. Some of the questions we've had, you've been able to answer them all. I appreciate that. I wish you the best in your retirement come this fall, and you will be greatly missed. And I appreciate very much your knowledge. So thank you very much. Thank you, Council President.
Thank you, Councilman. Anyone else? Mr. Beulah.
Yes, thank you, Council President. Just a comment, Dr. Moy. First of all, let me thank you for your service to the state, to the county. On a personal note, I think that I just want to echo what Council President Vincenti said. You have the right temperament. It's always been a pleasure working with you, and your institutional knowledge is just off the chart as far as I'm concerned. You've always been there to answer questions and to help us through this difficult time. And I just want to wish you and your family the best in your retirement. Maybe I'll get there one day. And just stay safe out there, and Godspeed. And thank you for all your service and all you do for the county. Thank you.
Thank you.
Thank you, Mr. Beulah. Mr. Wagner.
Dr. Moy, you have always been more than willing to provide all the answers to all the questions that we've ever asked of you, and certainly your staff has been right there to help us through many of the issues. And you know, at this time, we're sort of overshadowed by the coronavirus, but you've done so many more things over the years that you've been there that have been exemplary, down to Route 40 corridor and all the programs that you have implemented and overseen through the years. You've done a fantastic job, and I certainly appreciate all that you've done throughout the years, and certainly appreciate all that the willingness that you've done to provide this council with all the answers that we've inquired about and tried to get solved. So thank you very much, and certainly we wish you the very best in your retirement, you and your family, and we look forward to working with you as we select a new person to step in behind you. Thank you very much.
Thank you.
Mr. Johnson.
Dr. Moy, I just want to say that it's been a pleasure serving right beside you. Once again, everything has been said. There's no need to go over it. We've all said exactly your knowledge and what you've brought to the table, and I just want to say thank you from the bottom of my heart, and I appreciate everything that you've done, and you know, enjoy your time off. You deserve it. Thank you.
Thank you.
Thank you, Mr. Johnson. Mr. Schroeds.
Thank you, Council President. Dr. Moy, I'm going to miss you and so much. You've been stellar since I've known you 9 years ago, and I really think that during this pandemic, you've really shown your leadership through this entire thing, and also, of course, the opioid epidemic as well that we were dealing with. You don't hear quite as much about it because of COVID-19, but you know, you've just had incredible leadership throughout, and we're going to miss you personally. I know I am. You're just a great guy, and you know, I wish you all the best in your retirement. Surely well deserved, and you know, stay in touch with us. We are going to miss you dearly.
I will. Thank you.
Mr. Woods.
Thank you, Mr. President. Thank you, Dr. Moy, for presenting again, and thank you for letting us know your intentions. And I'm sorry that it's gone that way, but I completely understand, and I hope you have a good retirement. But we'll definitely have a chance to say that to you coming up in the future. So, and I'm sure even though you retire, you'll be here for a while with us. And you have done, as Councilmember Wagner, who I'm not sure how many health officers he's been with, but Mr. Schroeds and I have had two, so it's nice having your perspective there and your experience. I've wrote down some of the issues over the last 10 years, plus that I've been on the council 12, that we've gone through, and having someone of your background in place, I think made a big difference. From even the issues that didn't hit us as hard directly, the SARS and Ebola, but we always had an update from you. Lyme's, the dental health issues, the tobacco issues, and of course, opioid, and now this. So I actually have a question for you with it all. With that and your experience with 31 years in Maryland public health system and 9 here, how do you feel the impact of that health officer's job is on the county, and what do you feel you brought towards that? For instance, for me, you were the first to be a medical professional, to have a medical license, be an MD. And I think that brings a lot. And so this kind of have a two-part question because of what's to come. You know, over the last 12 years, I just highlighted a handful of public health issues, even though the majority of the health department's job is environmental health. You were able to bring and highlight and be there for us when we had more of the unseen things, more of the public health issue, the medical side of it. And I think we were very lucky to have a medical professional in that position at this point. So I'd like to see your perspective of that importance of having a medical professional in that area, in that spot, and what your take is on something of that nature.
Well, thank you, Councilman Woods. I appreciate that question. So the way I would summarize it, health officer should have a strong public health background, but of course, no one can know everything. So I think one of the areas that I wish I had a stronger background in would be environmental health, because environmental health is so important in the county. But in general, having a good understanding of all of the issues, behavioral health, communicable diseases, maternal child health, chronic diseases, you probably need somebody who has a strong background in public health in general. Second thing for the leader, though, is you need to have good management skills and leadership skills, because you still are running an organization. And a lot of that has to do with finding the best people and putting the best people in the right places. So that's a more operational thing, but that I can tell you is just as important day to day. I think the third thing, and this might have been one of the attributes that I was able to bring to the position, because we're in an unusual situation here in Maryland where the county health officer is a state employee rather than a county employee. It would really be good to have a health officer that has an understanding of the state system, because the state system can be extraordinarily complicated and challenging. But you really need to understand that, because that's where a lot of your budget issues come in, your regulatory issues come in, your human resources situations come in. And that might have been the one thing I was able to bring that others may not have been able to bring. But I think those three things, if you can get somebody that understands those three, has a handle on those things, I think you will do very well.
I completely agree with with your assessment. And the third point was actually, if I remember, I clearly remember, one of the things we talked about directly last go round. You probably remember, Mr. Schroeder, we worried about someone not understanding the state when it was a national search, because this will ultimately be a national search, and bringing someone that has no idea how the state or our county or the region operates, even as small as our, or not small, but even as our EMS system in this state. We're a very unique EMS system from how other states and counties operate. We're probably the best in the country, and for someone to come outside and see how we operate and do it, it's definitely a culture shock, and the personnel issues. Management, you brought up a couple weeks ago that the administrative portion of your job is about 90% of it, and so we definitely appreciate that. And you highlighted a lot of the key points, and we're very thankful to have you here. It's going to be a hard job to find someone to replace you. I'm sure you'll be there to help us do that, and I'm sure you'll still be here afterwards. So once again, thank you, and thank you for your thoughts there.
Well, thank you. And I'll definitely be here to help.
I didn't hear what you said, Dr. Moy.
I said, and I will definitely be here to help with that transition.
No doubt in my mind about that. Today we were doing some research. We pulled out our binder from the last search that we did to fill the health officer's position. We had nearly 100 applicants, and we were able to sift through them, go do our research, our due diligence, and at every corner, you kept coming to the top. And I would be remiss, Mr. Boniface, if I didn't ask you to comment, because you were a part of that last search.
I agree with you, Council President. We had applicants from all over the country, and we had the best candidate right in our own backyard, and he made it easy. And Dr. Moy, it's been a pleasure working with you, and we wish you the best, and you deserve all the retirement that awaits you. So thank you, sir, for your service to the county.
Thank you.
Dr. Moy, I guess we will be talking again tomorrow, I'm sure. We'll be working on some strategies moving forward. I have several things started today that we will add to our conversations while we're still working on our COVID-19 pandemic and also our reopening strategies.
Okay, appreciate it. Thank you.
I want to thank you again and look forward to talking to you tomorrow, sir. Good evening.
Okay, good evening. Thank you all.
We have 2 minutes before our scheduled public hearing time. Brian, do you think we want to pause, or do we want to continue on?
If you're available to continue on, I think we should just continue on.
I think council says we need to pause.
Well, I'm not talking about the electronics, but the public hearing has been advertised to start at 7:15. So that's sort of what we
Brian, we're going to pause for about a minute, and then we'll open up the public hearings. Mr. Boniface, we'll let you know when we're ready. Brian, if you'll count us down when it's time.
Yeah, so we're going at 7:30.